Okay, my name is Bree Roby. This is the date. Talking about the skeletal system. Don't have a flashcard, just going to try to see what I got. Okay, so this is my man Phil. He's going to be helping me. I'm going to use this chopstick to kind of help point. So, the skeletal system comprised of 4 components. That's the bones. You have ligaments, which are bone to bone. You have tendons, which are connect your muscles to bones, and then you have cartilage, which helps shape and cushion things like that. The skeletal system is comprised of 2 systems. You have the axial, which kind of runs down the middle of the body, which kind of like gives a structural support for your organs, your rib cage, your brain, and a lot of your other systems that we will get into. And then you have the appendicular, which is your limbs. Okay, so 2 systems. So we'll start with the axial. Like I said, it's composed of the skull and the vertebral column, and the rib cage. So the skull is made up of flat bones. Within the skull, you have 2 different types of bones that I'll mention. Well, I'll go ahead and mention those now. So there's 7 different types of bones in the body. Oh, I need to look here. Sorry, not the video. There's 7 different types of bones in the body. You have you have sutural bones that happen in the skull. You have the pneumatized bone, which is in the ethmoid bone, which is right in there. You have flat bones, which you see your sternum and your scapula. You have long bones, which are like your humerus, femurs. You have short bones, like what are in your wrist, fingers, wrist. You have irregular, which is your spinal column, pelvis. And you have sesamoid, which is your kneecap. So we'll get into that skull and talk about the bones there. In the skull can be broken into 2 components. You have the cranial, and then you have the facial. So we'll talk about the cranial first. There's 8 bones of the cranium. I'm just going to take my hands off. Okay, so in the cranium, I don't know if you can tell. Yeah, okay. You have the frontal bone, which makes up the forehead. You have 2 parietal bones, which make up sort of like the crown of your head. You have the occipital in the back. On the side, you have a temporal bone. And deep sort of in the eye, you have the sphenoid, which helps create that orbit. And then you have the ethmoid, which is largely responsible for a lot of the olfactory sense we have. So again, that's just occipital, frontal, 2 parietal, 2 temporal, sphenoid, and the ethmoid bone. Those all make up the cranial bones. And the facial bones, I like to break these up in 3 and 3. So you have 3 that sort of support the nose area, I'll say, of the skeleton. You have the nasal. Deep that is the inferior nasal concha, and the lacrimal. You have 2 sets of each of those, essentially, on each side of your face. You have, then the other set of 3, I'd say, would be the maxilla. 2 sets of that. You have the palatine, which is sort of like the palate as we know it. There's 2 of those. And then you have the zygomatic, which are these, like your cheekbones. You also have the mandible, which is the movable jaw, and you have the vomer, which from the pictures looks like it connects the maxilla to the sphenoid. So those are the bones that make up the skull. You also have little bitty bones in your ears. There's 3 of those, but I don't think we need to get into those. I hope not. So moving down, we have our irregular bones, which are the vertebrae. You have 7 cervical, you have 12 thoracic, and 5 lumbar. Then you have the coccyx and the sacrum. Okay, just the column, not the actual. These 2 bones of the pelvis are in the axial. Okay. Then you have your ribs, and you have your sternum. Top part of the sternum is the manubrium. Bottom piece is the xiphoid process, I believe. And that is the axial system. We'll move on to the appendicular. Like I said, you have flat bones, which are, another flat bone would be the scapula, the backbone of the shoulder, the posterior bone, which connects to the clavicle. It's often known as a collarbone. We have the humerus, which connects to that. You're hidden? No, I was going to sing a song. And as you move on down to the wrist, or to the forearm, you have the radius, which is on the lateral side of the arm. So radius and ulna being on the inside. And then when you get down into the hand, you have this region called the carpal region. And there are 8 bones in there. It's a little acronym. Sam likes to push the toy car fast. So going from laterally to medially, it's scaphoid, lunate, triquetrum, pisiform. And then you move down again, it's trapezium, trapezoid, capate, hamate, and those are all the bones within the carpal region. When you move down, you have the carpals, metacarpals, which are these 5. 1, 2, 3, 4, 5. And then just below those, you have phalanges. You have proximal, middle, and distal phalanges. And those will be the same thing in the feet too, but we'll get down to there. So that should be all those bones. You have your pelvis, which is just here. The ilium, ischium, and pubis. I don't think we really needed to say all that, but then you have your long bone here, femur. I don't know if I mentioned, but short bones, long bone. You have the patella, which is the kneecap. Moving on down, you have the tibia, which is the greater or the bigger of the lower leg bones. And then you have the fibula. Moving down to the ankle, you have the calcaneus on the back. Then you have the talus, the navicular just distal to that, and then you have the cuneiforms. You got the medial, this is really hard to do. You got the medial, intermediate, and lateral cuneiforms. And then you have the cuboid bone on the lateral side of the foot. Right there. And then again, like I said, you have 5 metacarpals. And then you have your phalanges again. Metatarsals and phalanges there. Tarsals, like feet on the tar. Carpals, like you're driving a car. That's typically how I've always remembered them. So yeah, those are the 2 divisions. You have the axial, the appendicular. I think I've managed to hit most of the bones, if not all the bones. 206 bones in the body. Obviously some duplicates. Let's set this back. So, as I've mentioned before, my goal is to be doctor of physical therapy, and so the bones is what I deal with every single day, and issues dealing with, especially with joints and ACL repairs and meniscus tears, and having to understand how the bones move, how they articulate with each other is basically what I deal with every day as a PTA currently. Having a better understanding of the bones going forward will only further my ability to assess and make good plan of cares for people and what they may need. So I think that's it.